Is there an autism gene? Well, yes. In fact, there are many. There are over 1,000 genes that have been identified on various chromosomes that likely are involved in developmental delays and/or autism. These genes affect neuroanatomy, which are the structures within the brain, and neurochemistry, which are the neurotransmitters and different things that make neurons fire. Now, some of these are inherited and some of these are spontaneous mutations, but it's much more complicated than we once thought. When we think about autism from a medical organizational standpoint or understanding how autism comes to be, it is actually kind of similar to cancer or dementia in that way. I want to be very clear though, autism is nothing like cancer or dementia as far as its symptoms or anything else about it. It's just that the way that it comes to be and the way that it expresses itself epigenetically, meaning with the effects of genetics and the interaction between those and the environment, are similar. So what that means is autism, similar to cancer and dementia, have different levels of epigenetic vulnerability. So there's certain genes that cause certain kinds of cancer and certain kinds of dementia. This seems to be true as well for autism or other neurodevelopmental delays. Similarly, sometimes it's inherited, while sometimes it's the result of certain environmental factors or toxins that can enter the body of the mother of a child or the child when they are young. So these can be things like infections, especially viral infections, lead, mercury, alcohol, any kind of other drug or substance. These things can all greatly affect how a gene is expressed. And this is why you can have somebody with the same genetic profile or almost the same genetic profile who can have a different kind of autism or a different presentation of autism, even if they have a mutation on the same gene. And we do know that certain forms of autism are inherited because we know that there's a tenfold increase between siblings, meaning that if one sibling has a diagnosis of autism, there's a 10 times greater chance that their other siblings would be diagnosed with autism as well. And this is a similar relationship between parents and children. We go back to this whole discussion between should autism continue to remain a spectrum as is, because there are certain genetic mutations that result in global developmental delays. And what I mean by that is somebody who has deficits kind of across the board. They have intellectual deficits, language delays, motor delays. And these conditions are usually associated with a particular mutation on a particular gene that affects development more across the board. Whereas a more traditional level 1, level 2 profile of autism, you'll see a different pattern where there's significant discrepancy between skills, where IQ or academic performance, for example, might be average or even exceptionally high, but the social communication skills and the social interaction may be exceptionally low. So that's more of a split in the skills that you would come to see. Having these great genetic differences and these great neurocognitive differences on formal testing really represents different kinds of profiles. And that's where you keep seeing this argument between, is it all one disorder or not? Because if the genetic basis and the environmental causes is so different, the presentation and the strengths and weaknesses of the person are so different, some feel, why is this the same disorder? And I'll get into this on future videos, but essentially the treatment can be so different. Now that we know so much more about the genetic basis or the genetic vulnerability for some of these types of autism, very specific interventions that will target certain genes or target certain chemicals within the body to address these different kinds of autism. So there are different ways that it comes about, and thus there are different ways to treat it for those who want treatment. And lastly, there are many children who have a genetic diagnosis of a particular disorder, maybe Angelman, Prader-Willi, Williams syndrome. But these families want services for their children, rightfully so, and they are having trouble getting the appropriate services or having these services reimbursed as they should be. And so they're ending up with an autism diagnosis so that they can get the appropriate services and the appropriate supports for their children and their family. Autism may not necessarily be the most appropriate diagnosis, but it's a means to an end. So it's a very complicated situation. But the more we learn about genetics, the more we better understand what autism really is.